What do bullets do to bone? I'm Megan. I have a degree in cultural anthropology, and for anthropologists in the field, being able to identify bullet trauma is imperative to their work. Gunshot wounds can present with a surprising variability on the skeleton, depending on the gun, bullets, and the distance from which it was fired. It's estimated that over 120,000 firearm injuries happen annually in the US. So it's important to understand their impact on the skeleton. Generally, when an individual presents with a gunshot wound, the standard procedure is bullet removal and debridement. Debridement is the process of removing necrotic and damaged flesh from the wound, though this can at times cause further damage. These wounds are often categorized by high or low velocity projectiles. Rifles tend to shoot high velocity projectiles, or bullets moving at more than 2,000 feet per second, whereas shotguns shoot low velocity projectiles at less than 2,000 feet per second. Understanding how this velocity affects impact helps anthropologists and crime scene investigators understand the trauma that occurred. Understanding the positioning of these projectiles helps them understand if it was self-inflicted, accidental, or fired with malicious intent. This group of skulls from the Silly Lad Medical Museum, where they were studying small arms fire and its effect on the skull. Interesting fact, the skull is most often studied in regard to gunshot wounds because of its smooth and largely uniform appearance. Bullets are generally characterized as deforming or non-deforming. Non-deforming bullets tend to stay intact and they penetrate deeper, whereas deforming bullets tend to fragment and cause more collateral damage. Bone has unique properties that makes it absorb this impact different than flesh. The closer range or higher velocity results in a more complex fracture pattern. Another good indicator of firearm trauma is spalding. Spalding occurs when there's a small entrance wound and a larger exit wound. Another good term to know is comminution. Comminution occurs when the bone is fractured in 3 or more places. Low velocity projectiles don't often result in these comminuted fractures and can be removed non-surgically, whereas their counterparts tend to result in these more complex fractures and often leave behind more fragments. That's a little bit more about firearm trauma. Here at the Bone Museum, we often work with forensic anthropologists, and that's a big part of their job. If you enjoyed this video and want to learn more, make sure to follow.